COVID-19, the disease that defined our lives in 2020.
2020 is now the deadliest year in U.S. history.
COVID-19 is a deadly infectious disease caused by the SARS-CoV-2 virus, with over 3 million people losing their lives to this disease thus far. The disease was initially discovered in Wuhan, China in late 2019. COVID-19 was then declared a public health emergency of international concern in late January 2020 and was later declared a pandemic on March 11th by the World Health Organization. The staggering death toll for this disease has made COVID-19 treatments a growing research industry. Monoclonal treatment is one way to combat the deadly effects of this disease. Monoclonal antibodies have been used as a treatment for many infectious diseases such as Ebola and rabies, so researchers worldwide have raced to find the effectiveness against COVID-19. In order to understand how monoclonal antibodies can be used as treatment for COVID-19, we must first understand what an antibody is. An antibody is a protein produced in the immune system to fight against infection. When germs such as viruses enter the human body, antibodies work to destroy the germs and stop them from entering the cells. A monoclonal antibody is a molecule developed in a laboratory that is designed to mimic or enhance the body's natural immune system response against an invader. SARS-CoV-2, the disease causing COVID-19, has a spike protein that aids the virus in attaching to human cells and entering them. Monoclonal antibodies used for COVID-19 bind to the spike protein to block the virus from entering the human cells. Monoclonal antibodies are usually given to patients in an IV infusion at a medical clinic. The research study was completed by a plethora of doctors and researchers from various institutions across the country as they studied the effectiveness of monoclonal antibodies as treatment for COVID-19. Specifically, the researchers posed the question of, are monoclonal antibody therapies associated with the reduced risk of adverse outcomes of COVID-19 in subpopulations that are at high risk of poor outcomes and across multiple variant epochs? In 2022, COVID-19 was one of the top 5 causes of death, according to the National Center for Health Statistics. With that, the overall motivation of this study was the urgency to find effective treatments for COVID-19 and researching the possible side effects. Specifically, the study looked at the ways antibodies could possibly lower the risk of severe COVID infections in those who likely had an anticipated poor outcome for COVID-19. To start, the study design was put together from the cohort of the University of California Irvine Medical Center, Center for Individualized Medicine at the Mayo Clinic, Houston Methodist, and Intermountain Healthcare. The study included 167,183 non-hospitalized COVID-19 patients 12 years or older, with the mean age being 47 years old. Within this study, 37.4% were diagnosed in the pre-Delta epoch, 26.6% in the Delta epoch, 10.7% in the Delta and Omicron BA1 epoch, and 25.4% in the Omicron epoch. The patients included in this study either had a laboratory-confirmed COVID-19 test or were referred to the healthcare system monoclonal antibody treatment. Patients in this cohort were all at high risk for a poor outcome of COVID-19, including criteria like having diabetes, kidney disease, old age, etc. The patients were administered one of the 4 different monoclonal antibody products in an outpatient clinical setting. The study focused on 4 effectiveness outcomes: emergency department visits, hospitalization, death, and a composite of hospitalization or death. These outcomes were looked at 14 days and 13 days from the patient's index date. An index date is the date of a patient's first positive test result, or the date the patient was referred to the medical center. The study also included sensitivity analysis to determine if bias was analyzed across the variant epochs. The results were mainly analyzed with marginal structural models in order to determine the treatment effectiveness. This also included subgroup analyses within the results, such as vaccination status, immunocompromised status, risk of severe COVID-19, and the variant epoch. Among the 167,183 participants in the study, a total of 25,421 patients received monoclonal antibody treatment. Those treated with monoclonal antibodies were linked to a lower odd emergency department and hospitalization visits within 12 days, and death within 30 days. Specifically, those treated saw 24% lower odds for emergency department visits within 14 days compared to non-treatment patients. Similarly, the odds of hospitalization were 48% lower in treated patients compared to those without treatment. The monoclonal antibodies were seen as being most effective against the odds of death, as the odds were 86% lower in those treated versus non-treated. A correlation the researchers also found was that monoclonal antibody treatment had a greater positive impact on those unvaccinated versus vaccinated. The treatment was effective during all variant epochs, but was seen most effective during the time of the Delta variant. Overall, the study included a wide represented range of people from young to old with various health conditions. The study included over 150,000 patients and was concluded from multiple parts of the United States. With that, there were still some flaws in the studies as they encountered several limitations as stated by the authors. One of the main limitations was that there may have been missing outcome data, as emergency visits and inpatient stays outside of the 4 healthcare systems were likely undocumented. The cause of death could also not always be determined, and some deaths that occurred in home or other facilities might not have been captured. The authors were also specifically studying patients who had met at least one of the criteria for being at high risk for COVID-19. This means that the outcomes of the study do not directly apply to healthy COVID-19 patients, as they were not participants in this study. The larger takeaway from this study is that monoclonal antibodies are an effective treatment for COVID-19 and can significantly lower people's risk for severe side effects and death. By going to an outpatient healthcare system and getting this treatment, the risk of hospitalization and emergency visits is lowered. The next steps in this field of research are to continue to follow for COVID-19 variants in order to determine which monoclonal antibodies are most effective for what variant. For COVID-19 treatment, this study is very positive as it proves there is effective treatment options. In the future, researchers will hopefully be able to produce a drug treatment for COVID-19, as monoclonal antibodies must be administered through an IV.